Welcome to Lunchtime with the Masters, brought to you by Pica. I'm Brett Robotsky, and we're fortunate today to have Dr. Richard Jacoby. Richard is the author of one of the best-selling books, Sugar Crush. He's been past president of the Arizona Podiatric Medical Association and president of the Association of Extremity Nerve Surgeons. He's been in Arizona for 40 years. This guy knows his stuff when it comes to nerves. So Richard, welcome to being on Lunchtime with the Masters.
Well, thank you for having me.
You've been on Meet the Masters and you shared some incredible sites. Sugar's really a poison.
It is a poison. It's been made to look like a condiment, but it's really a poison.
So if it is, why isn't the world catching on to this? I mean, inflammation seems to be what like Nick Perricone talked about with aging and skin. Everything's inflammation, and sugar seems to be the catalyst for inflammation.
Well, I think the misnomer here is people say they don't eat sugar. They don't put sugar in their coffee anymore, but the sugar is embedded in all the foods. 80% of the foods in the United States have high fructose corn syrup in it.
You and I were talking before about your view on heel pain. I mean, not only is it a biomechanical problem, they've got plenty of people with biomechanical problems who don't complain of pain.
That's correct. I think it's sugar plus trauma equals pain. So heel pain, plantar fasciitis, is a perfect example. In our clinic, which we have in Arizona, is dealt with mainly neuropathy, and heel pain is very prominent in that clinic. So we do our own nerve conduction test, and I have seen that the lateral plantar nerve is the nerve that is compressed in the tarsal tunnel, that it goes underneath the quadratus plantar.
So it's really a neuritis.
It really is. It is a neuritis. Tarsal tunnel, of course, has a lot of nerves, the posterior tibial and the medial and lateral plantar and the medial calcaneal nerve. But specifically, it's the lateral plantar nerve because it innervates the lateral aspect of the foot for the abductor digiti quinti. A good test is if they cannot abduct the little toe, that means that nerve that innervates that muscle is not working in heel pain.
Interesting. So it's not just the pronatory collapse. There's actually a functional test just to look about moving
Exactly.
the adductor digiti quinti brevis muscle.
Right. It's the same as the carpal tunnel because the median nerve, the thenar eminence, the initial symptoms are all the same. It's the autonomic first, then the sensory, and then loss of function with the motor component.
So tell me about the sugar. Could we take somebody who has a biomechanical abnormality, give them a chocolate milkshake, and all of a sudden they'll have heel pain?
I don't think it would be that easy, but maybe at McDonald's we could do that.
It's a good place to do the study.
I think it's an insidious process over time. Diabetes takes about 40 years. Dr. Melvin Hayden, who I work with in writing the book Sugar Crush, he has a feeling that diabetes is a conformational disease, meaning that it's the misfolding of protein. So over time, you're gradually replacing the insulin in your pancreas. And that can be measured not only in the pancreas, but in the foot. So we do what's called a SSR, sympathetic skin response to the skin, and we can see that the amplitude and the latency of the autonomic nervous system is decreasing over time. And those symptoms can absolutely be correlated with the heel pain.
So we can almost look at a pre-diabetic and tell you how pre-diabetic you are.
Absolutely.
Well, that's fascinating. When is the symptoms heel pain and when is the symptoms carpal tunnel?
I don't cut nerves out. I decompress them.
And your results, I remember when you were on Meet the Masters, you had some significant numbers.
We do. We have thousands of cases. So is carpal tunnel and diabetic neuropathy the same thing? Yes. There's genetic differences, certainly. There's mechanical differences, certainly. But that's why the heel pain is the #1 diagnosis in podiatry, because it's so common. So you have obesity plus biomechanics, and you get inflammation, and the body heals by fibrosis.
Wow.
That's how it heals.
No question. I want to thank you so much. This is a great topic for the forum. I think everybody should go to forum.podiatricsuccess.com and tell me what you think. Thank you so much for being with us, Richard.
Thank you.